In today's video, we are going to be discussing the Cough-O-Lator, or more commonly known as the Cough Assist. We are going to be explaining equipment, setup, purpose, education for the patient, practice, and cleaning. So to begin, we're going to identify the parts that will be needed. One blue corrugated tubing, 2 bacteria filters. If your patient can use a mouthpiece, you can use a mouthpiece with, you probably want to use a lip seal. And also include nose clips. If your patient is trached, you can use a swivel adapter. You will need a 15mm adapter, which will fit onto your swivel adapter and attach to the end of the corrugated tubing as so. For today's purposes, we will be using a pressure mask. You will also need a white adapter for the pressure mask. Some pressure masks don't have enough air in the cushion. You can add more air to the cushion to help eliminate a leak by obtaining a syringe, filling it full of air, and pushing the air through this port into the cushion area. Next, I'm going to review the buttons. You'll find a manual auto button. This button is important for setting the machine. You will always set your machine in manual mode, but in use for a patient, you will need to switch it to auto. The inhale button should always be set at 1. This determines the length of time for the inspiratory phase. The exhale button should always be set at 1. This determines the length of time for the exhalation phase. The pause button should be set at 2. This determines the time between the breaths. Of course, you have your manometer. Next, you have a toggle switch for the inhale and the exhale. This is used in setting your pressures on initial setup. You have your pressure button. This is for modifying your inspiratory and expiratory pressures. You have an inhale pressure knob button, which should always be in the maximum position. And last, an inhale flow knob, which you should always initiate in the highest part, which is the 3 squiggly lines. If this is too much for your patient, you can always switch to the 1 squiggly line for comfort. This is the on and off button. O is for off, I is for on. Next, we will be attaching our equipment to the Cough Assist. You will take a bacteria filter and attach it to the Cough Assist. Your corrugated blue tubing will then attach to the bacteria filter. And for today's purposes, we'll be using the mask. You will want to attach a bacteria filter to the mask. The bacterial filter helps us catch any secretions that may, if the patient has a lot of secretions, this will catch them. Attach the corrugated blue tubing to the mask. Now we're going to set the appropriate pressures. So we always start out at a pressure of a -15 on the expiratory side and a +15 on the inspiratory side. So I'm going to turn the machine on and demonstrate that. To begin that process, you will want to occlude your blue corrugated tubing and ensure that your machine is in manual mode. I'm going to turn the machine on. And the first thing I'm going to do is check the inspiratory pressure by pushing the toggle switch to the inhale side. And I can currently see that the pressure is set at about 25. I'm going to use my pressure knob to dial the pressure down and recheck my pressure setting. Now I'm at 20. I'm going to dial down just a little bit more. And currently I'm at a +15. So that's where I want to initiate my pressure. Now I want to check the exhalation pressure, the negative pressure, toggle to the exhalation side, and I'm currently exactly where I need to be set. I'm at a -15. Usually when you set one side of the manometer with either your inspiratory or expiratory pressure, it will set the other side of the manometer equally. Once we've got our pressure set, I'm going to turn the machine off now and make sure that I put the machine in auto mode. Now we're going to explain to the patient what the purpose of the equipment is for. So the Cough-O-Lator is designed to assist those people who have a weak cough and are unable to mobilize phlegm on their own. It will provide a big inspiratory breath to expand the lungs and immediately create a negative pressure or sucking feeling that lasts only a few seconds. This is an important time to express to your patient that they will need to cough during the exhalation phase to maximize the mobilization of their secretions. The patient will complete 5 cycles of an inspiratory and expiratory breath, and then you should allow the patient to rest for 20 to 30 seconds and then resume another set of 5 cycles. Once you have explained the process to the patient, hand the patient the appropriate device, whether it be the mouthpiece, the mask, or the trach swivel. Make sure that they understand that once the machine is turned on, it is effective immediately and will begin the inspiratory breath. Monitor your patient during the cycles and discontinue therapy if they have any adverse reactions. Today we are going to demonstrate the mask. When you place the mask on the patient, it is important to place the mask on the chin first. It's probably easier to put the mask on the person's face to help them if you're standing behind them, if they're sitting in a chair. However, if they're laying down, you'll just have to apply the mask from the front. So I'm going to put the mask up to my face. And now I have completed 1 cycle. You would let your patient rest for 30 seconds and apply another cycle. During this time, this would be good for you to possibly increase the inspiratory and the expiratory pressure so that we can maximize how much we're inflating the lungs and how much we're sucking out. If your patient doesn't tolerate it, you don't have to do that, but it's beneficial too. Once your therapy has been discontinued from your patient, of course, you're going to remove all your disposable equipment and throw it into the trash, and complete the process by cleaning your equipment with the Super Sani cloth, the purple top, by wiping it completely down. Very thoroughly. And placing a plastic bag over your piece of equipment and returning it to the area that you obtained it from. And we have completed our video.